Welcome. I'm Dr. Deuk. We're at the Deuk Spine Institute. This patient has just had her facets treated, but she also has left sacroiliac joint arthritis and pain. The SI joint is just above the tailbone. Hers on the left side is what's hurting her. We've just made a small incision. We're going to go in and basically sever 5 pain nerves to the joint. It's called a rhizotomy. I have to basically cut 5 of these pain nerves, and that takes the pain away. That is the best treatment in the world for this problem. We do it right here at Deuk Spine. All right, let's bring the fluoro back in. We do this under fluoroscopic guidance. I have to use the x-ray machine to find the spots to deaden the pain nerves. There's 5 pain nerves. They run along the, coming out of the foramen posteriorly, and they run laterally over to the joint. Tons of arthritis here, you can see on that x-ray. And shot. Give me a better view of the joint, please. Hold on. Shot. All right. So what I do is I march along the back side of the sacrum where the nerves run. These are pain nerves. All they do is transmit pain signals literally from the patient's painful joint up to their brain. And the idea of taking pain signals away from a painful joint is not something that I figured out. Doctors before me figured this out. And the way they figured it out is they discovered that patients that had leprosy many years ago, that had arthritis, well, their painful joints went away. The joint pain left when the leprosy advanced. Leprosy is basically a small parasite that affects, it's actually a bacteria, right? Berndes, bacteria? Yeah. That affects nerves. Huh? Leptospirochete. And it actually goes into the nerves and destroys them. And that's why lepers' tissue is falling off, and they don't even feel it. Like it denervates it. It's called a denervation. Shot. All right. Let me see again. Shot.
We have a few questions.
I'll take them.
These 2 questions are coming from Faisal on Facebook.
Hi, Faisal. On Facebook. Welcome.
First question they asked is, Doctor, are other surgeons in the USA or worldwide been in contact with you regarding training on your procedures, as it will be great if this treatment endorsed by yourself or trained by you is accessible to people who unfortunately can't travel to Florida, USA?
Faisal, great question. Unfortunately, no. Doctors these days are trained at universities for the most part, and their entire training is controlled by the companies that manufacture devices that go into the human body. And so they are promoting their devices to the doctors, and the doctors are putting in devices. My surgery uses no devices. It's more advanced than those device surgeries. I used to do the device surgeries all the time, and then I realized they're not necessary. The devices like screws, bolts, nuts, plates, cages, spinal stimulators, I mean, you name it, barricade device, all of those things, let's start with the left piriformis, are promoted by the industry that sells them. And medicine has been corrupted by those industries. So doctors are not interested in less invasive, better procedures. They want more invasive, higher paying procedures. And that's what they're recommending. Okay, we're going to end our stream. We'll be back for the piriformis.